Hi, my name is Cody Young. I'm a nurse practitioner for Baptist Health Cardiothoracic and Vascular Surgery. I've been a nurse going on 7 years now. I've worked for Baptist all of those years. I went to school at the University of Arkansas, Fort Smith for my bachelor's in science and nursing. I graduated in 2016. I pursued my master's degree in 2020 at Walden University in Minneapolis, Minnesota. I graduated in 2022. So I started out my career at Baptist as a new graduate nurse in the cardiovascular ICU. I worked there for 2 years under some great surgeons. After my tenure there, I decided to move up in the ranks and became a manager over the cardiovascular ICU and cardiac step-down unit, part of the critical care division, and then since then, I worked there for the last 4 years, built a great team around cardiovascular surgery, and then decided to go back to school and pursue my career as a nurse practitioner. And I was blessed with the opportunity to work with some good surgeons and stay on with Baptist Health. So starting out as a new graduate nurse in an intensive care unit, let alone a cardiovascular intensive care unit, is very challenging. You've got to have strong support in order to succeed, I would say. And the culture here with our director and the managers involved it's very, very supportive. So I believe that I was part of, maybe a little biased, but one of the best families within the system, within the healthcare system in the ICU. We've been through so much in the past 2 years. We have some of the strongest nurses in the hospital, and I would not be here today if it wasn't for the leadership that I had while I was in the ICU and the mentorship that I had while I was in the ICU. As an advanced practice nurse caring for cardiothoracic and vascular surgery patients, my role will be to pretty much be heavily involved in the clinic side of cardiovascular surgery with post-op surgical consults, new referrals, and then I'll also visit patients inside the hospital, round on them while our surgeons are in surgery, helping be that facilitator to get early orders in and help patients progress through their hospital stay seamlessly and get discharged, because our ultimate goal is to fix your problem and get you out the door healthy. Cardiovascular surgery in general has been close to home. I had a grandmother that actually went to cardiovascular surgery when I want to say it was my sophomore year in high school. And ever since then, I've always just fell in love with the post-operative care, the relationship that was built with the surgeons and the team here. And she actually had surgery here. So I knew a lot of the team when they're still here now. And so it hit home for me that, when I saw my grandmother go through that, I knew that that's where I wanted to be in my life. And so as a sophomore in high school, I went straight out of high school, straight to college to get my nursing degree. I knew with the goal of wanting to go to the cardiovascular intensive care unit, and just kind of fell into that role. Still love it today. Want to continue my career there, and I think that I'm blessed to have that opportunity.